Hello, everyone. My name is Marty Guthmiller. I am CEO at Orange City Area Health System, and today is November 24, and I'm bringing you the 74th edition of the COVID-19 Community Briefing. As today is I was going to say Monday, but today is Tuesday, but it's our first briefing of the week. I'll be offering a local scoreboard, and we'll just jump right into that right now. At Orange City Area Health System, we've had 1,414 positives of the 7,071 tested. That is a 19.99, so let's call it 20% positivity rate, slightly up from where we were at 19.7 and then 17.8 prior to that. For the week, we've had 112 positives of the 482 tested. That's a 23.2% rate. Still a pretty high rate, but not compared to the 2 weeks before that. So good news. The week prior was 40%, and the week before that was 56.7. So 56.7 to 40 to 23. Very good news, and we can be thankful for that on this week of Thanksgiving. Excuse me. In Sioux County, we've had 3,544 positives of the 11,562 tested. That's a 30.7% rate, up slightly from 29.5 and 28.8. The 3,544 represents 305 additional since last week, Monday. Yesterday, as an example, we had 10 positives of 40 tested in Sioux County. So yesterday's rate, just as a snapshot, was 25%. The 14-day average in Sioux County is heading in the right direction, still pretty high. We are number 9 in the state in Sioux County at 26.3%. Prior, we've been at 30, and then 29.7 and 28. So 26.3 is the lowest rate we've had in a while. So that's good and heading in the right direction. Statewide, by the way, we're at 19.7% statewide. So Sioux County number 9 at 26.3. Lyon County number 2 at 34.2. Down a little bit. I mean, they were at 36.3, 31.7, and 23.8. So they've had something happen up there with a number of positives. Plymouth County is number 13 in the state at 25.2%, but also going down. This is the time prior, we were at 31.1. Before that, we were at 28.9, and before that, 26.3. So 25.2 is a lower rating for Plymouth County, which is good. Bryan County has dropped way down, number 66 in the state. The rate is still kind of high at 18.9, but is now below the state average. O'Brien County was at 25.3 the last time we talked, 26 before that, and 25.9. So they've had a nice drop in O'Brien County. For your information, Jones County remains number 1 in the state at 36.6%, but they too are down from 50.8%. There remain 98 of 99 counties in the state at a 10% rate or higher. So while numbers are still high, some pretty good trends, particularly in this part of the state. Region 3, still a high hospitalization rate, 205 hospitalized in Region 3 hospitals, the 20 counties in Northwest Iowa. That is down though from 218. But up from the previous time at 183 and 167. So while we're down, one report doesn't make a trend. And so we were at 218, now at 205. We'll just keep monitoring where that is. 37 people in Region 3 in the ICU, not a great number there. It was at 38, 32, and 26. There are 24 of those 37 patients are on ventilators. So that's a pretty high number in Region 8, and that is up from 18 ventilator-supported patients. We did have 19 admissions in the last 24 hours. From a statewide basis, Iowa has 215,570 positives out of the 1.17 million tests. That's an 18.3% positivity rate. That's up from 16.9 and 15.9 respectively. Hospitalizations continue to go up. The Iowans hospitalized somewhere are 1,333. That includes 75 Iowans hospitalized outside of the state. The 1,333 is up 54 since last Monday. Closer to home, Sioux County has 11 residents currently hospitalized, down from 13. O'Brien County, 9, up from 8. Plymouth County, 13, up from 12. Lyon County, 7, up from 2. Woodbury County has 49, that's down from 51. And Polk County has 137, the highest number I've seen to date, and that is up from 114 from just last Monday. So a number of Iowans hospitalized across the state. Deaths have gone up at a pretty significant rate. We've had 2,224 deaths in the state of Iowa. That's 233 more since last Monday. The demographics have changed a little bit, slightly skewed heavily towards the older population. 92% now are 60 plus, 60 years and over. And I thought I'd just run through all of the age brackets now because they do them differently, as I mentioned last time. Ages 0 to 17, 0 deaths. Ages 18 to 29, 0 deaths. 30 to 39, 1%. 40 to 49, 2%. 50 to 59, 5%. 60 to 69, 16%. 70 to 79%, 70 to 79 is 24%, and 80 plus is 52. So, starting with age 30, by decade, you go from 1 to 2 to 5 to 16 to 24 to 52. So it's definitely skewed towards the older population. In fact, nearly half of all deaths in Iowa are from long-term care residents. And that's why it is so important to keep the virus out of nursing homes. And it is also one of the reasons why nursing home residents will receive high priority on vaccine administration as soon as it's available. And we'll talk a little bit more about that. Before I forget, I want to wish you all happy Thanksgiving. It's been quite a year. We do have a lot to be thankful for, and I'm going to mention some of those things shortly here relative to the numbers. But I was encouraged after not looking at these numbers for a few days. They are heading in the right direction. They're still high. We're not out of the woods, but it is. There are some good trends happening. Yesterday, we had one COVID patient in the Orange City Hospital. And so that was a welcome thing for everybody at this point. We are staged for the vaccine when it does arrive. We have no date. No one has been told any date. We are anticipating a matter of a few weeks, perhaps, but certainly are anticipating December receipt of some doses, but we have no idea how many. It's very different if we get 100 versus 1,000 as an example, and we're not expecting to get 1,000. And so we will be prioritizing those in accordance with the guidelines that the government has sent out. And again, nursing home residents and nursing home staff are high in that list, as are folks working in our ER and on the floor, as an example. So healthcare workers and senior care workers are going to receive the highest priority. We've had no new positives, so we can be thankful for the vaccine. We've had no new positives this past week at Prairie Ridge or Landsmere Ridge. We can be thankful and grateful for that as well. The numbers do seem to be improving. We want to ask you to continue to do your part, and thank you for what you've been doing to help mitigate the numbers so far. We do want you to enjoy Thanksgiving and the Thanksgiving weekend coming ahead. Another bit of good news, and maybe interesting news, and you can take it for what it's worth, but if you go to the coronavirus.iowa.gov website, there's a lot of stuff on there, as we've been saying all along, and but we haven't talked about this before, and this is Sioux County is now number 2 in the state in the serology testing. That is the testing that shows the antibody present. The antibody present reflects your immunity, and Sioux County has the second highest serology rating, positive rating in the state, significantly higher, and it's at a rate of 713 per 100,000 population. That's how they level the playing field across the state. So large counties, small counties, all measures the same. The number 1 county in the state, by the way, is 846. So Sioux County at 713 is significantly higher, 4 to 5 times higher in many cases than many other counties. What that means and is that in Sioux County, we've had a 12% positive serology testing. So if somebody gets tested for an antibody, 12% of those cases are, yes, you do have it, that it is there. The average in the state is 6. So we are double that average. That's a good thing. We can be thankful for that. It doesn't mean that we're all immune, but it does mean that perhaps all these positives that we've been having are being reflected a little bit, at least, in the immunity that's now present. So again, we're not out of the woods. We still have to do all the social distancing measures that we've been used to, the masking, the washing hands, the social distancing, all those kinds of things. But that's a good sign, and we can be thankful for that as well. So happy Thanksgiving. My next briefing will be in all likelihood next week, Monday. So enjoy your weekend, enjoy your Thanksgiving holiday, and thank you for joining us. I do want to mention that we ask that you stay strong through all of this. We're almost there. The vaccine is on the horizon. We're almost there. So stay strong, continue to stay vigilant, and above all else, we wish you good health. So thank you for joining us, and tune in next week, Monday, if of interest. Thanks again.